Hi, I'm Lucy and I'm from Families and Babies Breastfeeding Support. Today we're going to have a bit of a chat about hand expression. So the benefits of hand expression are it's completely free. We're in total control of it. It's really, really gentle and it's portable as well. We don't have to be lugging around massive amounts of kit to do so. Hand expression really does take practice. So postnatally, in those first few days, we're going to be expressing colostrum again. Milk usually comes in around the 3 to 5 day mark, and at that point, you may feel some engorgement. Engorgement is where the breasts fill with milk, and we can feel quite heavy, quite full, quite sore, and a little bit lumpy. So when we get engorged, babies may struggle to latch on a little bit because it's almost like latching onto a balloon, and they can't get that really big mouthful of breast tissue that we'd like. We do just want to take milk off for our comfort as well, really. We don't want to be hand expressing too much because then we could cause ourselves to have a little bit of an oversupply of milk. So we want to start off really, really relaxed when we're hand expressing, and that's going to stimulate that lovely hormone oxytocin. You may find it's easier to hand express in a shower or a bath. Keep your baby really, really close, and if you're unable to do that, you can also mimic that with lots of photos, videos of baby, and even items of baby's clothing or a muslin. We're going to start off by doing a little bit of massage, and we're either going to do that with just our fingertips, the whole palm of our hand, and we can even go in with those knuckles as well. We're always going to do this very, very gently. You don't want to cause yourself any pain whilst doing so. We're going to go all the way up the shoulder, and we're going to go all the way round the side of the breast under our armpit as well, just to make sure that we're getting all of the breast tissue. We're going to think of the breast like a clock face, split into segments, and we want to stimulate all of those different segments. So we do this lovely massage however you feel most comfortable to, always keeping ourselves nice and relaxed and really, really comfortable. We're then going to do a little bit of nipple stimulation. We're going to take our fingers and we're just going to roll our nipple in between the fingers. We're then going to take our thumb and our forefinger in a C shape, pop them at the base of the nipple, and just walk back a few centimetres. We're going to feel a little bit of a texture change in the breast tissue then. We're going to use our fingers to go back into our rib cage, and then we're going to compress forwards. Back into our rib cage, compress forwards. Back into our rib cage and compress forwards. Now, antenatally, or in those first few days postnatally, it will be colostrum, and the colostrum will just bead at the end of the nipple. When our milk comes in, which is usually around that 3 to 5 day mark, you might find that everything is just a little bit more free flowing. We're going to use exactly the same method we did when expressing colostrum. We're going to have our fingers in the C shape, walk them back from the base of the nipple into our rib cage and compress out towards the nipple. At first, it'll be beading, just as it was with colostrum, but it won't be long before we build up a little bit more of a flow. We can collect our milk in something like a sterile cup or any sort of sterile container, such as a bottle. If you aren't planning on feeding this milk to baby, you can just collect it in something to hand, such as a breast pad or a muslin. We can hand express postnatally for engorgement. We want to make sure that we stay as relaxed as possible. We start off with a little bit of massage and some nipple stimulation. We're going to get our fingers in a C shape, the forefinger and the thumb. We're going to pop them at the base of the nipple, walk a few centimetres back to where the texture changes. We're going to move our fingers towards our rib cage and compress out towards the front of the breast. You can express into a sterile container should you want to feed this milk to your baby, or if not, into a breast pad or a muslin. Hand expression really does take practice. Please speak to your midwife or health visitor for more information.